see the slide.
We can see the slides.
Okay, perfect.
So I just started recording. It is now 9:50, so I will begin the introduction. So thank you everyone for coming to Grecia's presentation. My name is Lindsay Fensel, and I will be the mediator for this presentation, which goes from 9:50 until 10:20. Grecia is speaking on the topic of impact of diet on male fertility. Please make sure to mute your microphones through the presentation and turn on your cameras if you do feel comfortable doing so. We will leave time for questions at the end. We do ask that you type your questions into the chat throughout the time, but do not send it until the end so we don't disturb the presenter. But please do write your questions at the end, as there will be time saved for that. I will be dropping a survey into the chat right before Grecia starts. And then just a heads up, the next presentation will start at 10:25 until 10:55. So, Grecia, you can take it from here.
Hello, everybody. Today I'm going to be presenting on male fertility. So if you were at Amelia's presentation, now we're going to see the other side. This topic is of interest to me because whenever I hear about fertility or trying to conceive, everybody concentrates on the female. What is she doing before? Is she taking her prenatal vitamins? Is she exercising? But they never look at what the other partner is doing. So I think it's really interesting that, we look at it as a full picture because making a child takes two, not one, and male holds 50% of the DNA. So I like something said by Ed Bottomley at Michigan College of Medicine. He states that infertility is not an inconvenience, it is a disease of the reproductive system. So I'll just start with my presentation. So today we're going to be looking at the definitions, the prevalence, then we'll look at causes, we'll review 3 research articles, and then we'll talk about some takeaways and we'll leave it open for questions. So infertility, the definition is the failure to conceive despite frequent unprotected intercourse for at least 1 year. So some of the main causes is decrease in semen quality, abnormalities including azoospermia, oligospermia, and abnormalities in semen morphology, motility, and sperm concentration. So this affects 15% of people globally, and 15% of the infertility causes are attributed to male fertility disorders. So some of the causes that were talked about in the research articles that I will be going over were anxiety, unhealthy eating habits, and environmental pollution. So we'll start and we'll take a look at the first study, which is titled The Relationship Between Major Dietary Patterns and Fertility Status in Iranian Men, a case control study. The reason that they chose Iranian men is because they do present a higher percentage of infertility. So the purpose of this study was to investigate the association between major dietary patterns and fertility status in our Iranian men. And this study, it was a cross-sectional study. The patients referred to the Yazad Reproductive Science Institute from July to December 2019. They were newly diagnosed infertile men by an andrologist, and again, they were Iranian. The age range was between 20 and 55. They recruited 400 males with infertility and 537 healthy individuals as a control group. Inclusion criteria for the test group included meeting at least one of the following criteria, which was sperm count less than 15 million per milliliter, normal morphology less than 4%, less than 1.5 milliliter of semen volume, and less than 40% of normal motility. The exclusion criteria was having a chronic disease, testicular atrophy, ejacular disorder, other abnormalities, and also if they had an adherence to a specific diet that could change the subject's habitual dietary patterns if they responded to less than 35 items to the food frequency questionnaire, or if they reported less than 800 calories or more than 4,200 calories. For the test group, inclusion criteria were healthy individuals with a history of infertility confirmed by a seminogram in the past 6 months without a history. And then for the exclusion criteria, it was occurrence of chronic reproductive tract diseases or hormonal abnormalities, having a family history of male reproductive disorders, adherence to specific diet that changed the subject's habitual dietary pattern. Again, responding to less than 35 items of the food frequency questionnaire, and reporting less than 800 calories or more than 4,200 calories. So for the assessment, they assessed the dietary patterns. So they used a food frequency questionnaire that included 168 food items. They were country specific, what they ate over the 12 months. The information was received using a face-to-face interview with a dietitian. They also looked at semen and analyzed it. They measured semen volume, sperm count, normal morphology, progressive motility. They looked at their physical activity and lifestyle, collecting it by using the short form of the International Physical Activity Questionnaire. They looked at their socioeconomic status, looking at residential status, occupation, and education. They also obtained anthropometric data, the use of pesticides and smoking. So that anthropometric data included hip circumference, waist circumference, BMI. They considered a pesticide user if they stored, mixed, loaded, or handled, or applied any sort of agricultural or home pesticides without wearing personal protective equipment in the last year. And they assessed smoking status by asking about habitual use of tobacco. So then looking at their dietary pattern, they divided it into 4 different patterns, which included the Western diet, healthy diet, the traditional diet, and the mixed diet. So when we look at the control versus the test group, they saw a significant difference between the groups. So higher in the control group, they saw the lowest level of physical activity, a higher waist circumference and hip circumference, and higher socioeconomic scores. In the test group, they saw a higher use of pesticides, a higher amount of energy intake, and there was a higher amount of smokers. So the results for this study revealed that men with greater adherence to healthy dietary patterns had a reduced risk of infertility, and this remained significant after considering for multiple confounders. The participants above the median with a Western dietary pattern had a significantly higher risk of infertility compared to those below the median. This was still significant after controlling for potential confounders. Men with greater adherence to a mixed dietary pattern had a significantly higher risk of infertility compared to those with lower adherence. This association was only significant after adjustment for confounders, and men above the median of the traditional dietary pattern had a 46% increased risk of infertility. And this association only became significant after controlling for confounders. So this is just a table that reflects the results that we previously talked about. So in the article, they also gave, the reasons why they think food affects fertility and some semen parameters. So literature suggests that there is an association between the intake of various nutrients and male health, sexual health. So for example, fish and seafood, they have more polyunsaturated fatty acids. And the PUFAs affect sperm motility. In the spermatozoa, elevated levels of EPA and DHA are noted and seen in the sperm cells and seminal plasma. If you increase vegetable intake, those are rich in phenols, antioxidants, magnesium, and research suggests that antioxidants are positively associated with sperm and seminal parameters. Higher contents of fiber contribute to reduced estrogen levels. Folate is a critical nutrient for methylation, stability, and DNA replication. Antioxidants can also increase the sperm concentration and improve its progressive motility. Now, when we look at the Western diet, evidence suggests that adherence to a Western diet is associated with an increased risk of infertility because they see a decline in sperm concentration, reduced motility, total sperm count, and abnormal sperm morphology. In conclusion, after reading this study, adherence to a healthy dietary pattern may reduce the risk of infertility, and a mixed and Western dietary patterns might be associated with an increased risk of male fertility. When we look at the study of the design, some of the strengths was the large sample size, the procurement of the information, and the similar population. Limitations were the case control study nature that limits causation, and I gave this study an EAL grade of positive, just because they did a good job explaining how they obtained all the information and the results. So now we're going to look at the second study, and this is the association between adherence to the Mediterranean diet and semen quality parameters in male partners of couples attempting fertility. So the purpose of this study was to determine if adherence to the Mediterranean diet is associated with better semen quality in men of subfertile couples attempting fertility. This was also a cross-sectional study that recruited 243 men that were evaluated from November 2013 to May 2016. They had 18 exclusions due to presence of azoospermia. And so for a final enrollment count of 225, exclusion criteria included medical history of some abnormalities in sperm, and also hormonal treatment in the last 6 months. Inclusion criteria included men aged 20 to 55 years that were seeking evaluation treatment with primary infertility at the Embryogenesis Assisted Conception Unit in Athens, Greece. Some details of this population were that 51.1% were overweight or obese and 20.9% were smokers. In this study, they performed a physical examination, and that same day they obtained a semen sample, and they analyzed for presence of varicocele or other abnormalities. They measured data including body weight, height, BMI, waist and hip circumference, blood pressure, and fasting blood glucose. They assessed for physical activity by using a validated version of the International Physical Activity Questionnaire. Anxiety was assessed using a validated version of the Spielberger State Trait Anxiety Inventory. Food and alcohol intake was also assessed through a food frequency questionnaire, and adherence to the Mediterranean diet was calculated by using a Med Diet score for each participant. So the range of the Med Diet score was between 0 and 55, and if you had a higher value, that indicated you had a greater adherence to the Mediterranean diet. So this is just, like the food frequency questionnaire that they had and how they obtained the scores of 0 to 55. So for the results, the Mediterranean score was positively correlated with sperm concentration, total sperm count, total and progressive motility, percent morphologically normal sperm. And they also saw that men with the lowest adherence to the Mediterranean diet had 2.6 times higher likelihood of having abnormal sperm concentration, total sperm count, and motility. BMI and waist circumference were both negatively correlated with semen quality measures, except for semen volume, and a negative correlation was also observed between semen parameters and anxiety levels. Participants with the higher adherence to the Mediterranean diet were also seen to have lower BMI values. They were less likely to be smokers, and they had a higher activity level. And these are just the graphs that represent what we talked about. This one represents that even after adjusting for confounding factors, the results were still statistically significant. So again, with the reasoning of how diet impacts this, they stated that a Mediterranean diet is high in anti-inflammatory properties and low in pro-inflammatory nutrients. Inflammation may affect reproduction through anatomical or functional alterations of the male accessory glands or a direct negative effect on the spermatozoa. The Mediterranean diet is high in omega-3 fatty acids. Sperm and testicular cells have a higher concentration of PUFAs. And then the Mediterranean diet is high in antioxidants that have been suggested to improve semen quality because of its protective effect against generation of reactive oxygen species. So in conclusion, the results suggest that a greater compliance to the Mediterranean diet could help improve semen quality and therefore improve fertility. This study design had some limitations. So one of the limitations, again, is that it is a cross-sectional study that limits the ability to determine causality. The study participants were elected from an IVF clinic, and generally they were unhealthy and overweight with low physical activity. So findings may not be extrapolated to a healthy population. I gave this study a neutral score because they were missing some data reported as significant. So for the final study, the combined effect of lifestyle intervention and antioxidant therapy on sperm DNA fragmentation and seminal oxidative stress in IVF patients, a pilot study. So IVF patients are patients that go in vitro fertilization. Okay, the purpose of the study was to evaluate the combined impact of a 3-month questionnaire-based personal lifestyle change and oral antioxidant therapy on DNA fragmentation index and oxidation reduction potential in men with infertility and DFI values of greater than 15% undergoing medically assisted reproduction. So this again was a cross-sectional study and it was double-blinded. They recruited 93 participants between November 2018 and May 2020. Inclusion criteria included men with idiopathic or unexplained infertility undergoing MAR treatment and 2 or more failed IVF/ICSI trials without explanation resulting in either embryo development arrest, implantation failure, biochemical pregnancy, or miscarriage. Exclusion criteria included smokers, including intake of cannabis, taking medications with unknown gynotoxic effects, patients with varicocele, malignancies, genetic causes of infertility, and those using any medication. So they also had a control group for this study of 10, and the inclusion criteria is that they were males in the mean age range of 31 years, non-smokers, and not suffering from any known diseases, and not fathered previous pregnancies. So in this study, they had the control and the test group deliver 2 semen samples in 14-day intervals. A semen analysis was performed and measured ejaculate volume, sperm concentration, total sperm number, and total motility and progressive motility. They also saw oxidation reduction potential, and they saw DNA fragmentation index. Those were also measured. The test group, if they saw that they had a DNA fragmentation index of more than 15%, they were asked to embark on a 3-month lifestyle intervention program based on the questionnaire consisting of lifestyle parameters. And they were given an antioxidant therapy treatment, including the following. And then the patients were also given some recommendations of lifestyle interventions according to their answers. And they covered recommendations that included 30 minutes of exercise, reduction in meat intake, caution about red meat, more intake of fruits and vegetables, reducing high sugar containing drinks, moderate alcohol intake. They recommended protection to pesticide exposure. They recommended mindful or stress reduction. And they advised against having cell phones in the trouser pocket or the laptop on their lap. So this is just a flow flow diagram of how they assessed them. So at the end, they only assessed 31 patients in the intervention, and they tried to see the correlation between the DNA fragmentation and the oxidation reduction potential. So for a follow-up, after the 3 months of intervention, a new semen sample was delivered and the physician checked for patient compliance. For the results, they saw a significant decrease in median DNA fragmentation index from 25.8% to 18% after the intervention. They also saw the DNA fragmentation index difference in volunteers that was significantly lower than the relatively higher difference observed after lifestyle and antioxidant intervention in the in vitro patients. So some of the strengths of this study is that they selected patients based on previous IVF failure and baseline DFI values shown to affect the probability of pregnancy potential. They had inclusion of healthy volunteer groups for comparison. And some of the limitations was that this was a small sample size. They had a lack of control group of males that met the requirement for a higher than 15% DFI. And they tried to analyze how DNA fragmentation index and oxidation reduction species were compared to each other. So I gave this study a negative score because they were missing many pieces of how they performed their study. In conclusion, the 3-month lifestyle change and antioxidant therapy program was significantly reduced the DFI. And then personalized lifestyle and antioxidant interventions may potentially improve the fertility of subfertile couples through an improved DNA fragmentation index. So now if we want to talk about some takeaways, so diet and lifestyle changes can improve fertility in males. Fertility parameters can be a good way to focus on gender-specific nutrition, and we do still need better research and more clinical styles to find causational conclusions. And as dietitians, this is good information because sometimes we can be faced with patients who express their frustration in not being able to conceive. And if we have another treatment that they can include with the treatments that they already receiving, or if they would like to try this first, it can be a good way to start and see if this helps improve their fertility so they can accomplish their goal of getting pregnant faster and, as a couple and conceiving a child. So do you guys have any questions? Well, thank you so much for joining me today.
All right, if no one has any questions, I once again will drop the link for the survey into the chat one more time, which I just did right now. And I will give you a little bit of what to expect for the upcoming presentations. So the next set of presentations will go from 10:25 to 10:55. The presentations will be Madison Kudik presenting on interventions for cancer cachexia, and Katrina Lopez with gut health and irritable bowel syndrome treatment. Thank you guys so much for coming.